Hi, my name is Kelly with Online Swim Clinic on YouTube and at OL Swim Clinic on Instagram. And I'm going to give you some free content here and some really great tips on how to troubleshoot your pain during swimming, open water swimming and pool swimming, and how to prevent pain and injury all right here, right now. So let's get started. There are some common places where people have pain as a swimmer, shoulders obviously being one of them. Neck pain, a lot of people have neck pain, especially if you're an open water swimmer. That's super common. Low back pain, this is another really common area for people to have pain and injury while swimming. Hips, hip flexor pain, and cramping in the feet and ankles. And calves. So let's go head to toe, okay? Maybe this is the best way for us to organize this. So when it comes to neck pain for swimming, this probably means that you're swimming up here, all in front. And the reason why I say it's in front is because when you're swimming horizontal, obviously this is the front and then your feet would be the back, right? So let's just visualize this horizontal body position throughout this entire video. When you're swimming up here in front, this is closed, all right? We're shortening the muscles of your neck and they're never lengthening. And most likely, you probably have stress in your daily life. And so these are already affected just simply by, your job or by the stress levels that you have. And so to really prevent neck pain and swimming, we have to finish our stroke, which means finishing in the back. And when you finish that stroke, you depress the scapula, which is your shoulder blade, and then you lengthen out here in the neck. So every time you pull, you should actually be getting a really great neck stretch. And when you're talking about efficiency and efficient swimmer, you want to hang out here a little while anyway. You want to be in glide position for a while, all right? So this is a really great chance to stretch out that neck, depress that scapula, and get that super open breath. And when I depress the scapula, I'm really using my lats and my rotator cuff muscles to engage and pull that scapula down. Another issue with neck pain, especially as open water swimming season gets started, is that breath, that sight and that breath. And I'm going to do a whole nother video on how to breathe for open water swimming. But ultimately, you don't need to lift your head out of the water so much to grab a sight. You really need to grab that sight with crocodile eyes, and you do not breathe while you sight. You probably have a wetsuit. You're probably a triathlete. You're probably a beginner swimmer trying to get out in that water right now because all the pools are closed. And your wetsuit is going to give you so much buoyancy, and that's going to band-aid all that terrible body positioning that's going to cause you pain. You're still going to experience that pain even though you have the buoyancy because you're jacking your body in weird positions, like trying to breathe in the front and trying to pull that 20-pound head out of the water, just pushing you down, like I've said in my previous videos. So for troubleshooting the neck for an open water swimmer, troubleshooting pain and injury prevention, pop those eyes out of the water and put your head back down right away and really focus on keeping that cervical spine nice and straight, okay? And lifted back up towards the surface of the water when you're in a horizontal position. So now let's move down to back pain. Let's just say low back pain as a swimmer. And that's probably because you have that overcurved lumbar spine where you're not in a posterior pelvic tilt position, which means your abs aren't really engaged and you're not using that breath to pull your belly button back towards your spine on your exhale and support that spine from the other side. So really dealing with low back pain problems in the water looks like land dry training preventatively. So it looks like your Pilates It looks like all your yoga ball work, which I'm seeing a ton of this on Instagram right now. All the swimmers are like, get on the yoga ball, which definitely get on the yoga ball and really work with that posterior pelvic tilt. Where we lose that pelvic tilt and where we have that low back pain is usually on that breath and usually into that rotation. So you might have it for like, a second, as you put your hand in the water and you're out here and you're gliding and you're really pulling this abdomen up and inside of you and supporting it. But then as you rotate onto your side, you're losing it and you're really swaying that back out. And that's a disconnect, which means your upper body is probably rotating and your lower body is not. So when you have that connection of that core strength and stability throughout the entire length of your swim, then as you rotate, your entire body rotates. And how you know this is happening is because your kick goes sideways. It goes sideways to sideways, sideways to sideways, okay? This flutter kick with your kickboard out here, this is not freestyle. This doesn't do anything. You are like never in this position, or you shouldn't be in this position where your kick is just flat. This is freestyle, rotating side to side. And as you rotate, keep the connection from your upper body to your lower body with your core and flatten out your lumbar, your low back, flatten it out. And that core strength will in turn help you prevent further injury and probably reduce pain if you already have back pain when you swim. Another common area to have for swimmers, now I'm talking to you swimmers, you are already a swimmer like me, is the hip flexors, because we really initiate our kick from the hip flexor, and our lifestyle, like me sitting down right now and talking to you in front of a screen, shortens my hip flexors. So if you have to sit for work, which you probably do, then you have just shortened hip flexors. They're not in the most ideal lengthened position, and you can work on that. I like to do like pump lunges, where I get into like a lunge position on dry land. Maybe I have some weights in my hands and I'm just kind of pumping that front leg. I'm not stepping back and lunging. I'm not lunging forward. I'm just in lunge position, pumping 10 times on each side. And I can really feel my hip flexors just like opening up. Yoga poses really do this, like all these standing, yang warrior poses. Really open up those hip flexors, and you really want them to be opened up. It's really hard to engage the glutes when your hip flexors are shortened or contracted. It's really hard. When you open up those hip flexors with stretches and with yoga and with all these things that we're talking about right now, these pumping lunges, then all of a sudden it's super easy to engage your glutes, and you really need to engage your glutes. Engaging those glutes will also prevent lumbar back pain and injury. So having those open hip flexors, stretching it out, if you go to a competitive swim meet and you look at the best team and the best swimmers, wow, what's their warm up, before their race? They're literally just standing there pumping those legs back and forth, really opening up that hip flexor, because they know that they're going to get their power kick from the hip flexor. Now, if you're a triathlete right now and you're saying, I don't even kick, why do I need to open up my hip flexors? Don't forget what I just said. That's the only way that you're going to engage your glutes. And you really need to engage your glutes in your life all the time, even if you're not a swimmer. I'm just going to say it, okay? I'll explain later why it's so important to have your glutes engaged, but it really, really is, believe me, okay? The other thing is, like, what if you want to pass someone in your race? You don't have to use your kick. I'm not going to sit here and tell you you have to use your kick. I am going to tell you you have to have a kick to use when you want it. Your kick should be like a light switch, okay? You should be able to turn it on when you want it turned on and turn it off when you don't want to use it, okay? You don't want to just have this loose, floppy legs dragging behind you, okay? There are dangers in the open water. I've had to use my kick numerous times to get out of some shady situations in the water. Maybe there's a boat coming towards me. Maybe there's some animal that's coming towards me. passing people, making sure they don't pass me. I need to be able to turn that kick on. You need to have some lengthened hip flexors, over lengthened, okay? Our natural current lifestyle has a lot of things shortened in the front of our body. We drive, shortening our pecs here, engaging our pecs too much and not engaging like our rhomboids and things like that. If you have upper back pain as a swimmer, then the rhomboids and the lower trapezius really need to be engaged. And that looks like that depressing the scapula. So your shoulder blades right here on your back, they need to be brought together and brought down. And the way that we can do that in swimming, now I'm jumping back up to the top of the body, right? The way that we can do that in swimming, take your time, okay? Take your time. This isn't, not every day is a competition, okay? Your training, your pool training should look like injury prevention all the time. That way, when you get to the competition, you don't have all these terrible, terrible habits. You've already broken them. You're spending hours in the pool anyways. You're spending hours training, okay? You want to do Ironman. You want to do ultra swimming. You want to do marathon swimming, okay? You want to do this stuff. You're spending so much time training. We need to undo these bad habits and only make sure that you have good habits, okay? So the rhomboids and the lower trap, it looks like as you're pulling down and you're done, you finish that, right? Now I'm open here. I can rotate my body, suck in my belly, okay? Support my lumbar, grab my breath. And during my recovery, this is when I really engage and pull back right here. High elbow, okay? This isn't old school. This is still school, okay? We're definitely having high elbows, okay? It's aerodynamic. It's gonna save your shoulders here, all right? This straight arm recovery, this isn't helping anyone except for some sprinter in a pool, which is great if that's who you are, okay? But these open water swimmers, these people that wanna swim competitions, greater than 200 meters, all right, which is everybody, really on this recovery, really pull back on that shoulder. And I can feel my lower trap really engaged. I can feel my rhomboids really engaged. Rowing, little rows. Make sure when you're doing all your back exercises, like rows, seated rows, you're not up here. Don't do this. Okay, keep it down, keep it depressed. Pull back, hold and squeeze your scapula together, okay? Squeeze them together. Let's go back down the body and get down to the ankles and calf and cramps and feet cramps and all this kind of stuff. This is runny body stuff, all right? You probably, if you're a new to swimming swimmer, you might have been a runner before. If you're a triathlete, obviously you are running. Swimming is usually people's weakest leg. And so it's really about retraining the anterior tibialis muscles, because those are shortened and probably super strong, pulling your toes up, right? You need to be like tiptoe walking a lot, practicing tiptoes, and we need to lengthen the front of your shins. The front of your shins would be the anterior tibialis muscle, and swimming is like flippy floppy ankles. So I like preventative ABCs with your feet. So A, B, C, all right, do all the ABCs or whatever language you speak, do that alphabet with your feet, and then reverse it, all right? And do it in the water. So when you're sitting down on the pool edge, give yourself a really good foot warm up, okay? Walk around on your tiptoes at home, in the kitchen. Ultimately, a swimmer's foot is really, it's almost like deformed, right? We have super flippy floppy ankles, and the anterior tibialis is like really lengthened. I have that like ballerina point with my toes. And like I said, if you have been doing running or cycling for a while, then you probably just don't have that flexibility, which you just really need to get there. Put those high heels on and just walk around, all right? That's a swimmer's foot. So I hope this video helps you with your injury prevention. If you like my videos, like them, subscribe, and share these videos. A lot of people have injury while they're swimming. I also sell Seeking Health supplements and US enzyme supplements, and those are on the affiliate links are on there, are on all my platforms. So please, if you buy supplements, shop with me and help support me, because I'm giving you all this content for free. And this is really the highest quality supplements that you can find. Thanks for watching.